So I'm Stuart Keeble, I'm the Director of Public Health and Communities at Suffolk County Council. This year's annual public health report focused on a really important topic, which is supporting people to age well. Aging well in Suffolk is important for a number of reasons. I think the first thing for me actually is about how we talk about ageing. I wanted to focus on this topic because we often talk about it from a negative perspective. Our population is getting old, that's going to have a huge impact on our health and social care. And for me, actually, ageing is an important part of our life, and actually it brings opportunities, and actually we need to look at it in a more positive way rather than focusing on potentially the impact on our services. When I think about ageing well, then for me it's not about just those people over 75 or over 80. We often focus on particular age groups, but actually we all age at a different rate due to our circumstances. So inequalities plays a huge role. So in some parts of Suffolk, people are only living maybe up to age 55 in good health, whereas other people in other parts of Suffolk are living into their 70s. And that impacts both on their opportunities around jobs, their quality of life. So what we need to be doing is focusing on, actually we could go all the way back to when children, if we start to have a best start in life. But there are definitely key points in our lives, and around when we get into the 30s and 40s, our health behaviours, the things that we do can impact on that health and that health journey. So we need to support people to have a good quality of life, things around their homes and houses, but also around the food we eat and the jobs we do. So if we can try and help optimise them, then people will be able to age well, stay well longer, and have a better quality of life. So I think I've asked people to take 3 key points from the report. The first one is that there isn't one thing we can do, and it needs a collective action from all of us. The second point is that people's ageing experience differs across our population, and as I said before, there's significant inequality. So actually we need to be working with people at different points in time to try and support them to age well. And I think the third point is that there is a huge amount of energy around this already, and we need to really embrace that. So I think what's great about this year's report is actually working alongside the likes of Health Watch Suffolk, who did a lot of the work around engaging with our residents about their experience of ageing well, and also the Integrated Care Academy, who have worked with frontline practitioners, local authorities and many different partners as part of their challenge labs. As well as focusing on the kind of the normal statutory services and our voluntary sector organisations and our wider health and care partners, this report also has a recommendation around working with the private sector. Now, the vast majority of people in Suffolk will never touch one of our statutory services, so I think there's a big opportunity for local businesses to look at what they can do and what they can offer as services to residents to age well and stay well in their home. And I think that actually will be a large economic opportunity given the demographic shift that we are seeing. So the recommendations are deliberately broad because there isn't one thing we can do. But I think the key bit for me, the main recommendation is that we as a system need to start working together to look at how we can support residents to age well. And that's driven by the data we're seeing, but also the feedback from our residents have said, and the fantastic work that's been done by the likes of Health Watch and Integrated Care Academy to support this work. What we need to do next, though, is to come back together as system partners to look at what we can do, some quick solutions, some things that we can do now. And they were coming out in spades. There was lots of different examples and ideas and energy, and start to bring people together to start to put some of those actions in place. Because the risk is, if not, we could be sitting there trying to build a big report and lots of plans and all the rest of it, but actually we need to build on the action that's taking place now, and then working with the wider health and care system, the wider public sector, businesses, about what things we can change to improve things in the future.